There's one other diagram that I especially like, and I use this all the time also, and I want you to learn this so you understand how chiropractic works. See, chiropractic works biologically, you might say, by a breakdown build-up process. In other words, it's no different than physical training. We break a muscle down and then it heals back up better than it was before. Do you realize lifting weights is a controlled strain? You're literally straining the muscle so it rebuilds stronger and hopefully more flexible. That's what it is. Do you realize that chiropractic is a controlled sprain? It's a sprain of the joints. Okay? You're taking the vertebra and you're shifting it, causing a little muscle strain and ligament sprain of the joint, therefore engaging a process as a result of that of healing. That is why chiropractic is not the on-off switch. Yes, you can get some pressure off the nerves, but nothing really has happened yet. So the whole symptom practic thing is just for chiropractors that just know nothing about chiropractic, nothing about physiology, nothing about anatomy, and they've got no nuts to actually be able to tell people the truth. Okay? But we're going to tell people the truth, and the truth is this. When we make adjustments, it's a breakdown process, and then there'll be a healing back up that occurs. I draw it like this. Once again, I draw this on face paper sheets commonly, but they'll just say, I've been coming in for a while. Why do I not feel any better? And I'll say, Sherry, it's because we're going boom, 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 boom with our adjustments, and then as I back off on the frequency, it will have a chance to heal up better than it was. And the extent that we break it down will determine how much better it gets. The deeper the hole they dig, the taller the skyscraper is going to be. The farther down the trampoline goes, the higher up the kid is going to fly. The more we break the spine down, the better it's going to rebuild. The more we break down a muscle, the more it's going to rebuild. All right? And then I'll say, you're like right here. Or I'll say, I won't ask you how you're doing for about 4 to 6 weeks because we're breaking it down right now. We're breaking it down. I don't expect you to be better. It's not this, okay? It's not, okay, again on the optimal health diagram, if the person's down here, it's not they start getting adjusted and it goes like this. It's this. In fact, when we draw the diagram here, and you say we're going to go boom, 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 and get you better, what this is just this part of the diagram. Like that. So you must be able to explain to patients what's going on. They're going to get sore before they get better. And I will flat out say, if you came in and you were feeling great, just what I'm doing alone is going to make you sore. If you come in here in pain and I start adjusting you, it's going to make you sore. But because it's making you sore, just like if you work out your leg muscles and they're sore, it's going to rebuild better. And that's how it works. And that's how awesome chiropractic is. And the more deconditioned and the worse shape somebody's in, the more adjustments it's going to take and the more sore they're going to be. But that's okay, because it's sore in the positive direction versus sore and painful going into trouble. So I always say, hey, we're coming in, we're going to go boom, 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 with all these adjustments. I know, okay? But then as we back off on the frequency, the ligaments and tendons and muscles and bones and nerves will have a chance to heal. They'll have a chance to finally really heal. And that's when you'll come around and you'll start to feel better and better and better. All right? So every adjustment builds on the one before. That's why it's so important to tap on the shoulder, make every visit. Okay? So it's so important that we understand this diagram as chiropractors, that we're breaking the spine down and it's healing back up. That's why it takes the adjustments it takes. That's why it takes the frequency it takes. And once again, okay, we have to realize that what people really need is they need to come in every single day for at least a couple of weeks. Many people could come in 2 or 3 times a day, easily. They could come in at 9 a.m., at about 2 o'clock, and about 6 o'clock, boom, 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 for an entire week. Then they could go to every single day for at least 2 or 3 weeks, okay, and then drop off to 3 adjustments a week for the rest of their life. Easily. Especially, okay, if someone is down here and they're in trouble like this. All right? But if someone comes in and they're actually doing pretty good, yeah, you break it down and then it's pretty easy for them to get up into shape. But here, they're 2,000 adjustments behind in their life? Crying out loud. You could work on them 300 times in the year. In fact, how about that care plan? Bill, for you in a situation like this, with your age, your overall level of health, all the things you've done, the traumas you've had in your life, the kind of work that you do, I recommend 300 visits this year, 300 treatments, 300 spinal adjustments over the course of the next 12 months. Now, that's quite conservative, considering you're about 2,000, 3,000 visits behind. So the 300 we're going to use now to get you shaped back up, it's going to just be priceless in what it's going to do for your health. Then after that, we'll just drop down to 100 per year ongoing. It'll be incredible. I can say that with a total straight face because I know it's right. Some people in that bad a shape, they're in big, big trouble. Okay? And they're going to die earlier. They're going to have future massive pain and misery. Cane, walker, wheelchair, diaper, tons of medication, losing their mind because their head's clogged up full of pills that the commercials got them to buy when, of course, did they really need it or not? Probably not. Okay? So we're out to really understand what's going on and understand how chiropractic works, able to explain it well using diagrams, and it makes sense to people because it's simply the truth. It is simply the truth. And so this diagram, along with the other ones we have here, your mastery of those, you're being able to grab your pen quick and do them to explain things as needed in the office, outside of the office, at talks and events. It'll be incredible. All of these have been honed into shape through 100+ talks in 100+ businesses, plus a ton of talks in office, plus a ton of talks with individual patients and families and whatever else. And they've been forged and forged and forged by all the questions people ask. Okay? What if I'm going once a month? Or how come this? Or how come it's sore? Why am I not better? And all of this stuff. All the questions, the thousands of them over 15 years, let's say, have hammered these diagrams into shape, and they will address almost any of the questions a patient might have beautifully, smartly, credibly, giving you incredible validity and every chance in the world to get the patient under care, keep them under care, and prompt them to refer their family and friends. And that's the name of the game, is for you to see as many people as you can, have as much reach as you can, change your community as much as